This week's Ask Dr. Durie question comes from a patient who is concerned because he had been having very short remissions with his treatment. However, his doctor has said that he didn't seem to have any high-risk features which would be normally linked to shorter remissions, and so wanted to know, is it possible to have this type of pattern with short remissions when the high-risk features don't show up? And this is quite an interesting and important point, and the answer is both yes and no. The yes part of the answer is that we normally look for the high-risk features such as the translocation 414, the 17p minus deletion, abnormal chromosomes on cytogenetics, or a high-risk pattern with gene expression profiling. But about 30% of patients who can have a high-risk pattern do not show anything with these tests. So it definitely is possible to have a high-risk pattern, and we just have not learned all of the molecular changes that would indicate this tendency. But when I see this pattern, the no part of this answer is that I am concerned that maybe it would be possible to fine-tune the treatment and get a better result. It could be that the short remissions, if they're not due to high-risk features which have not been detected, are maybe due to the way that the treatment has been given. Maybe it would be better to push harder and get a deeper response. Maybe it would be very important to maintain the remission rather than allow the relapse to occur. Maybe it would be good to use a different combination to just achieve a better overall result. And so it's possible that some of the details of the treatment could have resulted in these shorter remissions. And so this is another area where it's very important to talk to the doctor, make sure that maybe the high-risk reports, were they put into your chart or not, maybe they're missing. Do you actually have some high-risk features? Or maybe your treatment could be fine-tuned to get a better outcome, which is certainly what you need and what you want. So a very important question this week from a patient concerned about having some shorter remissions.